The Department of Basic Education's Director General Hubert Mathanzima Mweli posted in a tweet today that he was very concerned about social distancing at matric marking centers at Merensky High School in Limpopo. Mweli was doing site inspections at marking centers in Limpopo after revelations that over 200 matric exam markers have tested positive for COVID-19 and two have lost their lives due to COVID-19 in Kwazulu-Natal. Joining me now to talk about the safety of matric marking centers is National Teachers Union General Secretary Cynthia Barnes. Cynthia, good evening and thank you very much for your time tonight on the newsfeed late night. SARTU saying they are worried about the state of affairs at some marking centers in the province, particularly in Kwazulu-Natal. Also, the Provincial Education Department spokesperson Muzim Klambi saying that markers are based, I beg your pardon, the spokesperson for the Department of Education nationally saying although regular mass screenings are conducted, it seems there's an indication that there's a high number of markers who are arriving at centers with positive tests. Talk to me about what is happening there as far as the state of complying with the rules and adhering to the compulsory screening and mask wearing at marking centers.
Thank you very much and good evening, as well as to the listeners at home. For example, let us go back and look at, we're taking all of the markers in the entire country, where we sat down and we lay down the rules of how to go about adhering to the regulations of the COVID-19. And when we sat down with the DG as well as the other unions, we put down saying that they must wear PPEs all the time. They must adhere to the social distancing. They must also make it a point that they don't mix together. And there must be those people that are being hired to make it a point that this goes well. But it's so unfortunate. And also pass my condolences to the families of those that passed on at Escort. The thing is, with there's a different issue with KZN, because in most cases you find that the provinces are doing different things. For example, we do understand that in Eastern Cape, that was the only province that decided to test the teachers when they came into the marking center. But I'm a bit worried why the other provinces didn't do it, because maybe that was going to limit the number of people coming in with the virus. For example, those two people that died, how many of them that are being infected now? And those people that are being infected, some of them are not showing the signs, and they are going to go back home and infect their own family members. So that on its own is very worrying, and we don't know what to do about it. But the thing is, it seems as if there is a gap between the implementation as well as the planning, because they were supposed to plan prior to say that if the markers are coming in, they are going to be screened, they are going to be tested in order for them to come in. And if maybe they couldn't do that, they were going to say, okay, markers, tell them, markers, go and test and come back with the results, telling us that we have tested, that we'll be showing that you've been tested for maybe 72 hours. But they did not do that. So that on its own is telling us that the Department of Education needs to do a lot when it comes to the safety of the teachers as well as the health of the teachers. Because if you look at this, it shows that the teachers themselves are going to die, meaning that as the virus is, as the wave is there, and then the virus is spreading, more teachers are going to come out with the disease, and they are going to infect others. And I wonder how the schools are going to open, because the teachers are sick as we speak.
So as NATO, you would advocate and you would support the idea of random testing at the marking centers?
Yes, we will really suggest that the teachers must be tested, because this is a virus that is going to kill everyone, and it is dangerous. So if we are going to neglect the testing, that means you are saying the teachers, oh, anybody can die, because it's not only the teachers that are dying. For example, there are those teachers that are traveling from the marking center back to their homes. Those teachers that are traveling back to their home, they are going to infect their families as well. So if teachers could be tested each and every day, not only scanning, because the temperature does not tell you whether the person does have the virus or not, but it would be much better if they are being tested in order to avoid this fatality that is taking place in the marking centers.
I mean, of course, quite sensitive to the issues and, of course, the lives that have been lost in this particular one. But I would want to understand why would your colleagues, knowing that they are positive, would want to still continue and go to the marking centers?
Some of the colleagues that don't even go for the testing, they're scared to go for the test. They've got that problem of saying this does not exist. And some of them, they fail to understand that if you are sick, you must not go to the marking center. And some of them had comorbidities and never went to school to teach. But when it was supposed to go for marking, they went. So that was the problem. There was nothing we as the union could say to the teachers, because we do understand that teachers need money. The department is not giving them money. For example, they were supposed to be getting their increment, they did not get it, so they need the money. So they were taking chances to go to the market. Not to say we are saying they should do what, but we are saying it's because they need the money. Then they thought maybe if they go to the market, that is when they are going to get the money.
Right. Of course, this...
We are not seriously condoning it.
Yeah. This, of course, has got psychological impact also on all the other markers who could have been in the room with the two that have now come to their demise because of the virus. What psychological assistance are those teachers getting?
At the present moment, the department is supposed to be helping those people that are there, because as a union, we can't go there and then take those the people to the psychologist or whatsoever. But they really need to be set to isolation where they are going to be maybe taught, or maybe going to be told what to do thereafter, because they are being traumatized. You can't do the work when you're being traumatized, and they are very scared of whatever they saw in front of them. So that on its own, the marking is not going to be the marking that we need to be. That means that the children themselves, their marks are not going to be good, because teachers are only thinking of the people that died in the very same environment where they are.
Yeah. And nobody wants marking centers to be super spreaders of the virus, but it seems some of the teachers are also not observing the social distancing rules. Satu saying some of the markers are chatting in large groups and they're not distancing, and some are even not, I suppose, wearing, as you mentioned, the proper PPE. I mean, what needs to happen there?
They need to wear the proper PPEs. Whoever is not found wearing the PPE should maybe be disciplined, or something else needs to be done, because these are elderly people. They are people that know the rules and everything. So therefore they should adhere to it, because this disease is really going to kill them. So therefore, if some of the centers, you'll find that they're sitting in groups and they're chatting, and they are not even wearing these PPEs, as we have said. There's no social distancing. So that on its own is a problem. And even if they're going to the dining hall, you'll find them queuing in line and not even observing the 1.5 in between them. So we seriously need to come back when the teachers are going back to school, to sit down with them and tell them, no, this is not what they are supposed to do. They must also take good care of their own health, as well as the safety of their own health as well. So if they are not going to adhere to the rules, then that is how they are going to, that's a manner in which they are going to be spreading the disease to other people.
Now, marking was supposed to have been taking place in 181 matric marking centers around the country over an 18-day period. Do you think that is still a realistic time frame for the marking to be completed, considering that even at the beginning of the marking, a number of markers did not show up because of COVID-19. Now, of course, there have been some starts and stops in some other provinces because of markers testing positive. I mean, is that 18-day period still going to be met?
I don't think so. Maybe in some other subjects it will be met, because when the first markers withdrew, they had to bring in the markers that were said to be the substitutes, if I may say so, or the reserves that were said to be. But you can't bring in markers when the marking has started, maybe 10 days. Then you bring in new markers, because those markers need to be trained. They need to sit down with the chief marker and be able to mark the papers, and they also need to mark the dummy scripts. So you can't bring them in. So therefore, that is why I'm saying I don't think the marking will finish on time. If it does, if it finishes on time, that will be a miracle. But I don't think it will.
All right, Cynthia Barnes, appreciate your time. Thanks for joining us tonight. General Secretary for NATU there, Cynthia Barnes, responding, of course, to the latest news as far as marking centers are concerned and the spread of COVID-19.